Does the scientific data that you've seen suggest that we need further restrictions and further restrictions now?
Well, I mean, in a word, yes. We're at risk in a difficult moment. Infections are rising fast. We're identifying more than 90,000 cases a day now, but that will translate actually into hundreds of thousands of new cases a day. And in London, which is the worst affected at the moment, and incidentally is also, well, not incidentally, is also the least well vaccinated part of the country, hospital admissions are rising significantly. So we need to act to hold down the rate of hospital admissions, reduce the pressure on the workforce. And of course, a lot of people are off sick at the moment. And most importantly of all, give people the chance to get vaccinated, to get boosted, and allow time for those vaccinations to have effect.
Let's unpack some of that in a moment. But before we do that, aside from the booster and vaccination, what would you say are the most effective steps, policy steps that could be taken now to slow the spread of Omicron?
The effective steps are the steps that we can all take, which have been the steps all along, which is that this is a virus that transmits by moving from one person to another, particularly through aerosol and droplet spread, so respiratory spread. And so distancing people one from another is by far and away the most effective way of stopping that spread, but also wearing close-fitted masks. And, it's clear that people's behavior is becoming more cautious, and that makes common sense. So it is about, as I say, well-fitting masks, avoiding crowded, indoor, poorly ventilated spaces, lots of people, reducing contacts, and making sure that we test a lot. So we've got tests, and we should use the results. If we have symptoms, we should isolate. These are all measures that we can take. And Plan B, is obviously heading in that direction, but the modelling projections suggest that it won't be sufficient on its own to flatten the peak and reduce the pressure on the health system and on people being off work.
Would you support Chris Whitty's advice? Reduce the number of households that mix, try and avoid essentially social mixing if you can over the next period?
Yes, I mean, what Chris Whitty said, and, he is the nation's public health doctor, and he's giving excellent public health advice, is that, reduce your contacts to those that really matter to you. So, the less the better. But, I mean, this is the second Christmas that has the potential to be significantly ruined for a number of people. And so, there are also the health issues of not being able to see your loved ones. But so, the answer is to be prudent and, only have the social contacts which are really important to you.
You've had the task of trying to evaluate significant amounts of scientific data for government and advise ministers and so on. That is proving crucial right now. There is a major issue about the modelling that is emerging from various sources. I put to the Health Secretary this morning what the chair of the Modelling Committee of SAGE said, which is that we are generally asked to model, we are generally modelling what we are asked to model. In a sense, what he's saying is that there is the evidence that is being produced is that which the politicians are asking in order to support further restrictions. Does that make sense to you, that actually what's happening here?
It doesn't make any sense at all, actually. The first thing to do is to say that the modelers produce projections, they don't produce predictions, and all of the models have wide uncertainties attached to them as well. And this has been no different throughout this pandemic at all. I mean, what the modelers are being asked to do is to model what happens under various conditions of, free mixing, less mixing, to provide the policymakers with the best possible evidence they can have. And there's no suggestion that, the evidence is there to support policy. The evidence is there to help policymakers decide. And that's always been the case. And, one of the big challenges for everyone is that there is inevitably a great deal of uncertainty, particularly during the early phases of a wave of any pandemic infection, and particularly now where we've got the Omicron variant. It's new. We still don't know a lot about it. So, frankly, the evidence is not there that it is either less severe or more severe than the Delta variant. We just don't know. But what we do know is that the cases are rising very fast. I mean, anyone who just looks at the numbers of cases can see that. You can just look at the graph, which is widely available, and you can see that the numbers are going up extremely rapidly. So that's what the modelling is all about.
So, but you do see why this is becoming a political issue, that the critics of the government are essentially saying that the evidence that is being demanded is only evidence that will support the government's desire to impose greater restrictions. And when different scenarios are being offered, as scientists always do, you rightly say they're not predictions, they are different possibilities. That the possibility on which ministers are acting are the worst scenarios. Is that,
but with respect,
a criticism that you can see the sense of?
No, the last thing any government wants to do is to increase the restrictions. I mean, there's no political pressure of any sort, as it were, to increase the restrictions. It's all about actually responding to the evidence from a pandemic where the number of cases are rising fast. We have a new variant. We have pressure on the health service with increased hospital admissions. And the risks are that because of the lag, and that's always the challenge, that people, forget each time that from the moment you get an infection, become symptomatic, to when you may have to go into hospital is a week to 10 days or so. And then it's another, 2 or 3 weeks before the worst effects of the infection, particularly death, may occur. And so, if you're going to act, you actually have to act in advance. And that's one of the difficult things. But, the job of the scientists is to actually provide the evidence for the policymakers. The policymakers are politicians, and therefore, ultimately, the decisions are political decisions. But there's no pressure on SAGE or SAGE advisors or the modelers to do anything other than to provide the best possible evidence, given that there are uncertainties at any moment.
So, Mark, thank you so much for your time this morning. Much appreciated.
Pleasure.